Good evening, everybody, and welcome on this platform of Society for Eczema Studies. There are both dermatologists, colleagues of us, as well as our patients who have suffered from eczema, either suffered or currently suffering from eczema. That is the purpose of this, entire exercise today. Before I go to actual exercise of patient to doctor interaction, I would like to take this privilege of introducing the Society for Eczema Studies to all of you. Society for Eczema Studies is a society which is formed with a very focused idea of patient education, doctors' education, as well as knowledge sharing and disseminating the knowledge among the dermatologists about eczema, doing research and doing junior doctors education and not only in the country but also spreading the news about the eczema work all over the world. And this is the first society of its kind with this focused idea and focused motto, and one of the 8 or 9 societies in the world which is dedicated to the cause of eczema. It was born on 29th of March 2022. So we have just crossed 2 years of age. In these 2 years, we have been able to do a good amount of work, a good amount of launch, national launch in more than 12 cities of the of the country, international launch in more than 5 or 6 countries, webinars in the form of 20 webinars, which are national webinars, and 6 to 7 international webinars, then research grant for our younger colleagues who are working in the field of eczema. And we conducted one national conference in Kolkata in 2023. And last year we had a sales update in Bhubaneswar. And, we have conducted a study for 2 years on clinical and epidemiological data on atopic dermatitis. In 42 centers across the country, more than 150 very efficient and erudite dermatologists all over India have participated in it. And so far the data collection is going on, the computation is going on. Approximately more than 2,000 patients data we have been able to assemble. And once this is completed and written, it is going to be the largest pediatric atopic dermatitis research with clinical and epidemiological informations from Asia, undoubtedly, and one of the 3 or 4 in the world. We are having in pipeline another very basic genetic level atopic dermatitis research work, which we are going to start very soon in another couple of months. There are a couple of more ideas we have. Today, we are here for an altogether different kind of, purpose of the society, which actually, you can say by Freudian slip came first out of my, mouth. The purpose of Society for Eczema Studies, patient education, that, I said at the beginning. We always felt that disease like eczema, atopic dermatitis, is a disease for not only the patients, but the entire family. And a lot of knowledge gap is there because of our busy schedule, because of lack of communication, and there should be appropriate forum to address this, where the patients who suffer very badly from this disease, the disease which has got a tremendous impact on the quality of life, because atopic dermatitis is a disease which by and large affects the pediatric age group, that means up to 18 years of age. And this is the age group where not only the physical growth, mental growth, education, social stabilization, social interaction, development of career, lot of things happen. So all these things, they go for a toss unless and until the disease has been properly treated and the doctor has properly explained the disease to the patients. So the doctor-patient relationship is of utmost importance. This is what is called counseling. Nowadays, in fact, it has been labeled as therapeutic patient education or TPE. That means it is a part of treatment. Writing prescription is not the total treatment unless and until you explain it to your patients. That is what it is believed now all over the world. And this is the unique idea for Society for Eczema Studies of Patient Forum. And this idea has been conceptualized by the Society for Eczema Studies Academy chairperson. I am very proud to say, and I sincerely thank and congratulate Dr. Professor Deepika Pandhi for conceptualizing the idea, not only conceptualizing it, but also make it happen. When she shared this idea with me, so I thought that it is going to be extremely difficult, but she made it possible today with her continuous, incessant hard work and relentless effort. So this is my privilege to invite Professor Dr. Deepika Pandey, Academy Chair, to say a few words about this forum, what is the idea behind it, how she got support from others, and what we are going to do today. So over to you, Deepika.
Thank you, sir. I mean, it's a pleasure. It's a small group now, and I hope I would take this as a sensitizing meeting. We have a couple of patients. We have the president of the society, Dr. Sandeep Andhar. We have Dr. Abhijit Sahu, who's the faculty. So firstly, if everybody doesn't mind, it would be nice to see everyone because it's a very
Yes.
small group. And, when
Yes.
we are interacting, what I was telling before we formally started, this is like if you were actually live in a group and interacting with each other. That is the purpose. So here there is no faculty and there is no patient and doctor. We are all here to learn from each other. So if
Yes.
everybody doesn't mind, could you please put your camera on? It's nice to see faces on a virtual platform. Thank you, Siddharth. So Siddharth is our patient, and we have Sushmita, who's also a patient, Dr. Vishal, Dr. Bharti, and Subhojit, Tavneet, Dr. Fareem and Vishal, and Dr. Saket. I don't know. I mean, if it would be nice because when we are talking, the first rule of communication is we know whom we are talking to. It makes the communication easier. So the idea of this, and we have Dr. Fareen. Dr. Fareen, Tavneet, if you could just put on your video. So the idea of this patient support portal is, there are eczema, it is said, impairs the quality of life maximally as compared to almost any dermatosis. And the only way that you can reduce the impairment is not just treatment, but also, in a way, a hand holding or a very good, like Sir said, bilateral communication, because each patient has unique issues. So only if we are able to address those unique issues, we can improve the quality of life. And how we do it, it's a long process. It's a chronic relapsing disease. And in fact, the best person who can help us do it is the patient himself or herself. So for example, this platform provides not only education as in patient education booklets, it provides videos. In fact, some of the videos have been developed by people who are here. Bharti has made one video. Dr. Safia has made another video. She has joined. And so it's a, and Dr. Fareen, Dr. Safia, Dr. Abhijit, and I don't see Dr. Abhishek, they have contributed to the content of this. And of course, everything has been possible only by the, the backbone of every work that we do, that is Tapas. He is constantly,
Absolutely
available, making the flyers and providing. And so this platform is thanks to Mr. Tapas. So thank you, Tapas, for all the efforts. And so this is the icebreaker. And we also want that you people should actively give inputs, how we can make this a more dynamic. We include more of our patients so that, it's not just to have numbers, it is so that we learn better. And we know what is the need that we need to, how we can best help each other. So that is the whole purpose. And the one unique thing, I don't know if you notice, if you see the website, you can translate into multiple languages. So every content that is there, not a picture, but anything that's typed can be translated into, like Sushmita ji speaks Bengali. So it can be translated by a click into Bengali. So that is the aim, because we want that the message should reach. And the best way that you can help is if you give feedback and contribute and make other people join, so that as this grows stronger, the learning will perpetuate and we'll do better. So, sir, now I request you to please, let's initiate the discussion. And we have Poshali and Sushmita and Siddharth,
Thank you, Deepika.
right? So,
Once again, I sincerely thank, Dr. Bharti, Dr. Vishal and Tabneet, Poshali, Shushmita and Tanushia. Of course, our own team and Tapas, who has very rightly been pointed out as the backbone of our activities. So we will embark on the patient interaction and we'll have a free discussion with our patients who have suffered from atopic dermatitis. It is heartening to see right now for this kind of program. Let me tell you very honestly that this kind of program is of global standard. Anywhere in the world, when they will come to know that Society for Eczema Studies is having a direct patient-doctor relationship, something which is called in, television's language, a TRP, our TRP will increase like, rocket. And this is the first of its kind in Indian dermatology scenario. All, credit goes to Dr. Deepika Pandey and, her team for creating this platform. So a very big hand for her. Now we will come to first, Poshali. Poshali, could you just tell us what are you doing currently?
Good evening, everyone. Presently, I'm pursuing BTech Biotechnology at the SRM Institute of Technology in Chennai, and I'm in third year currently. So, yeah.
Yeah, right. If you could tell us that you suffered from atopic dermatitis from what age?
Not that I remember, but then 6 months. Yeah.
6 months.
Yeah.
Okay. So whatever your parents tell you, so what was the first symptom which they or sign they noticed on your skin? And how did they take it initially?
Firstly, as I've heard from my parents, like they told that there were very like small dots and red colored flares on my skin. Like if I would by unknowingly also, if I would itch on my skin, they would swell up and inflame. So, and then earlier they thought that might be because of the heat and the weather changes that actually takes time for a baby's skin to adapt to it for the tissues and all. But then like my mom thought that maybe because it was kind of increasing day by day, and even after taking medications, it would only go away for a temporary period of time, but then again would come back as a chronic one. So after that, only I went to my doctor.
Okay. How much itching you used to have?
Excessive.
Do you remember how much botheration you used to have at that
Yeah,
very tender age?
yeah, absolutely. Not at that age, but then since I was in class one or two, it was like I was actually understanding what is happening. That something I have that is an issue with me. I have a skin problem, and that is causing all these problems, the allergies and the flares and all those things. Those were like intense itching during summer seasons and extreme dryness of the skin during the winters. So it was like north and south pole. Either of the seasons, whichever comes, I was in problem. So, and then these were the things that used to be faced by me mostly. And even a mosquito, if it would bite me, that would be changing into some kind of different appearance in my skin, like, and it would persist for 3 or 4 days like that. It used to take time to heal, actually.
Very intelligent answer, Paushali. Paushali, the way Paushali has mentioned, without being a doctor, she has felt it on her skin, and that exactly just she has mentioned that it used to be worse during summer because of sweating and during winter because of dryness. And that is exactly what we know about atopic dermatitis. The itching in atopic dermatitis is just like a double-edged sword. Itch when sweating is one of the criteria of Hannifin-Reich as diagnostic minor criteria. That means with sweating and sticky sensation, person start itching. And that is atopics are, they sweat also a lot. And this is something which happens during summer. On the contrary, in winter, the skin becomes dry and they start scratching. So in winter, we need moisturization of the skin repeatedly. Very good answer, Paushali.
Thank you.
Abhijit, would you like to ask some questions to Paushali? Paushali, you can ask also. Tabneet ji, you can ask some questions about.
We also have Siddharth. I mean, he's
Yes.
also he's currently
Actually,
undergoing.
Yes.
Siddharth,
I want to add
But
my
feel
feeling.
free to ask or participate. I mean,
Yes.
Okay, ma'am.
anybody who wants to participate, please just
Yes.
raise your hand.
Let us have free flow discussion kind of thing. Siddharth, you can ask your question. You can just raise your hand.
Okay.
Then I'll come to you. Okay.
Okay.
Yes, Abhijit.
Yeah, actually, I want to add my feeling into it. Whatever Toshali said till now, I'm also a father of 3.5-year-old baby, and she also has this kind of papillary urticaria problem. So I can sense the kind of apprehension, stress her parents went through. Even a smallest scratch, smallest blemish cause a lot of apprehension, anxiety, tension among the parents. So it's a long drawn battle. She had suffered. Now she probably in a much better shape. So not only for the sufferer, for the parents also, it's a very, 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 very debilitating condition. That's what I want to make.
Right. And Deepika, would you like to ask some questions to Paushali?
So, Paushali, I mean, mainly, I think, what did you do right? How do you manage, or is it something that is in the back of your mind while you're studying? Siddharth is also a student. So, yeah, so, what are you, I mean, how have you been able to manage your disease independently? Now you're not with your parents. Abhijit was saying that he, as a parent, is very involved. So I'm sure your parents were involved with your journey with eczema, but now that you are far away.
Firstly, I would start by saying that when I got diagnosed with it, that time my parents were obviously very tense and they were thinking, how am I gonna recover from this? Because as it was, the days were passing by, it was worsening. So obviously at such a small age, even they were confused and bothered that what is happening. And also because of that, it's a skin infection. So it is exposed to the outer environment and the surroundings as well, right? So even at that small age, I might not think, okay, fine, I have these things, I'll be okay. But then after that, when I actually started my adolescent age, at that point of time, I would understand the social uh, stigmas and all those things. And then people would actually look at you in a different way. They have this thing in their mind that, okay, fine, you shouldn't, even if I'm traveling in a bus or an auto or however I'm doing that, people would be staying a bit far. Not only people, I mean, public outside my house, but my friends did that to me. So, yeah, that time I used to come home and say my mother that, they did this to me today in the class and I didn't like it and all. But then she used to make me understand. And it is not only me who had struggled in that point of time, it was my parents as well who were actually very tense and had always supported me in every step. And my doctor had already been so supportive that he was also acting as a mental support for my parents as well. Because me being the patient, I was not able to make them understand, okay, fine, because they are parents, they will be tense about their words. So yeah, in that way, obviously my parents have done a lot. Like till 15 or 16 years, I had to go under treatment, and then Yeah, I used to like most of the times I used to wear covered clothes, full sleeves, or have some ointment on my skin so that I don't get exposed to the UV rays at that much, so that I don't sweat or it doesn't itch like that. So these were some of the things that have, and also no nails. Yeah,
So you have been using a sunscreen and
yeah,
regular
yeah.
moisturizer. So are you still on moisturizer or?
No.
So,
So after class 10, I have stopped.
okay,
Unless I need it, I don't use.
that's good. Siddharth, would you like to say something?
यस मैम मैम मेरे को पूछना था जैसे अभी मॉइस्चराइजर अगर नहीं लगाते अपने तो क्या फर्क पड़ता है उससे?
Sir, would you like to answer that?
Right. Siddharth, thing is that if you don't apply, I can answer to you in English also or Hindi also, whatever you
Okay.
prefer. Right? So-
Whatever you
Acha.
are comfortable with.
So I don't think you have any difficulty in understanding English.
No, no.
Okay. Probably you prefer to talk in Hindi more, isn't it?
Yes, sir.
Yeah,
I'm more comfortable in
In
Hindi.
Hindi, right, right.
Yeah.
So moisturizer, see, atopic dermatitis or eczema, basically ये होता है ड्राई स्किन का बैकग्राउंड में, राइट?
Yes, sir.
सो ड्राई स्किन जैसे एक कहावत है ना इंग्लिश में, देयर कैनॉट बी ए स्मोक विदाउट फायर, मतलब स्मोक हो
sir.
रहा है मतलब फायर तो है डेफिनेटली, राइट? तो स्मोक
Yes,
नहीं तो
sir.
कहाँ से आ रहा है? Similarly, there cannot be an eczema without a dry skin. This is our dictum in dermatology. So that means eczema means underlying skin वो ड्राई होना ही पड़ेगा. ऑयली स्किन में एक्जिमा नहीं होता है कभी. आपने कभी नहीं देखे होंगे, हमने कभी नहीं देखा किसी को पिंपल्स हो रहा है, एक्नी है पूरा फेस में और साथ में एक्जिमा भी है, हमने कभी नहीं देखा, क्योंकि होता
Yes,
नहीं है.
sir.
सो ड्राई स्किन जब है तब एक्जिमा फॉर्म होता है, और एक्जिमा फॉर्म होता है तो वो क्या है कि इमिडिएटली पर्सन स्क्रैचिंग करते जाते हैं, और वो स्क्रैचिंग करते करते वो धीरे धीरे वो एक्जिमा स्प्रेड हो जाता है, right? So it spreads like that, right? So to cut this cycle or to stop this cycle of each scratch phenomena, we call it itching हो रहा है आपको, आप स्क्रैचिंग किया फिर बढ़ गया, तो इसको स्टॉप करने के लिए फर्स्ट थिंग वन शुड डू इज द मॉइस्चराइजेशन. मॉइस्चराइज द स्किन. मॉइस्चराइज करने का बाद दूसरा ट्रीटमेंट का बात आता है, होता है टॉपिकल स्टेरॉइड लगाओ, दूसरा कुछ लगाओ, बट मॉइस्चराइजेशन इज अ मस्ट, राइट? सो
But
मॉइस्ट हाँ,
yes,
यस
sir.
यस सिद्धार्थ.
बट सर मतलब लास्ट 2 days से मैंने देखा है मतलब मेरा मतलब वो गीला हो रहा था पूरा शर्ट और वो सब, तो मैंने मॉइस्चराइजर बंद कर दिया तो अब वो सूखने लगा है पूरा, और मतलब जैसा अपने हार्ड हो जाता है ना वैसा हो गया है मेरे, और अब जलन और कुछ भी नहीं होती. बस अब मैंने मॉइस्चराइजर 2 दिन से लगाया नहीं बिल्कुल भी,
ये भी
तो
ठीक
मेरे
है, राइट? अब बोलो. हाँ,
मतलब इम्प्रूवमेंट मेरे को ऐसा लग रहा है कि इससे इम्प्रूवमेंट हो सकता है, और
नहीं,
इचिंग भी बहुत कम होती है.
यू आर राइट. हमने अभी अभी बात की, जैसे एटोपिक डर्मेटाइटिस जिसमें इचिंग जो होता है वो डबल एजेड सोड है. ड्यूरिंग विंटर जो स्किन जब बहुत ज्यादा ड्राई हो जाता है, आप तो नॉर्थ इंडिया में रहते हो, उधर तो बहुत ज्यादा विंटर होता है, बहुत कोल्ड होता है,
यस सर.
और स्किन भी बहुत ड्राई होता है उधर विंटर के
यस
टाइम
सर.
में, राइट? उसका ऊपर से एडिशनल इंसल्ट इज आप उसमें वुलन स्वेटर वगैरह कोट वगैरह पहन रहे हो जो वुलन स्किन में लग रहा है, और इनवेरिएबली नेक में इचिंग वगैरह चालू हो जाता है. तो ये विंटर में हुई. और ये भी जो समर होता है उसमें आजकल स्वेटिंग भी ज्यादा होता है. पहले नॉर्थ इंडिया में इतना ज्यादा स्वेटिंग नहीं होता था, ड्राई हीट होता था. ये हमारा
हाँ
कोस्टल एरिया जैसे ईस्टर्न इंडिया में और वेस्टर्न इंडिया में कैलकाटा मुंबई जैसे इस एरिया में ज्यादा ह्यूमिडिटी होता था, और
हाँ
भुवनेश्वर. तो आजकल आई हैव सीन द चेंजेस इन द क्लाइमेट. दिस इज बिकॉज ऑफ ग्लोबल क्लाइमेटिक चेंज. तो ज्यादा ह्यूमिडिटी भी होता है, और ह्यूमिडिटी में इचिंग जो होता है, अभी अभी जो बात कर रहे थे हम, ह्यूमिडिटी में जो इचिंग होता है उसमें क्या है कि कई बार मॉइस्चराइजर लगाने से वो थोड़ा सा क्या है कि तो थोड़ा ये हो जाता है, स्प्रेड आउट हो जाता है. तो उस
यस सर.
टाइम मॉइस्चराइजर मत लगाओ. यू फॉर फ्यू डेज यू जस्ट अप्लाई, यू जस्ट टेक बाथ और लोकल कॉम्प्रेसेस करो, ऑइंटमेंट लगाओ मिनिमम अमाउंट, तो उसको जाने दो. फिर उसका बाद थोड़ा से चेंज ऑफ वेदर के साथ after this hot summer there will be a shower or rain. उस टाइम फिर थोड़ा
Yes.
सा वेदर चेंज हो जाएगा, ह्यूमिडिटी कम हो जाएगा, थोड़ा से ये टेम्परेचर भी चेंज हो जाएगा. Again you apply moisturizer. You get my point?
Okay, sir.
Because it is a chronic disease, so you have to be mentally prepared for managing it for long term purpose. कैसे हम इसको long term में manage करें, तो उसका एक
Yes, sir.
strategy बनाने ला चाहिए. वो आपको आपका डॉक्टर हेल्प करेंगे वो बनाने में, right?
Yes.
That this is the whole idea इसका यहाँ आज मिलने का, क्योंकि यही बोला ना कि it's a very long term disease. So
Yes,
every patient behaves like Poshali now after 10th hasn't had any lesions, but अगर आपको हो रहा है, जैसे जब oozing हो रहा है उसके ऊपर क्रीम नहीं लगाना है, जैसे आप बोल रहे हो
Yes.
ना lesions ooze कर रहे हैं,
हाँ.
आपको इसका फ्लेयर जब बहुत ज्यादा है, एक्जिमा इंक्रीज है, बहुत ज्यादा फ्लूइड है, तो तभी आप बोल रहे हो ना कि क्लोथ्स पे स्टिक कर रहा था. सो
हाँ.
वही इन अ वे एवरी पेशेंट को सीखना है कि कैसे डिपेंडिंग ऑन द स्टेज ऑफ एक्जिमा
हाँ.
व्हाट हैज
You
टू बी
can control.
स्टार्टेड एंड व्हाट हैज टू बी स्टॉप,
Yes.
राइट? सो सिर्फ ट्रीटमेंट तो सेम है, पर कैसे करना है, दैट इज
हाँ.
इम्पोर्टेंट. And again, I
Everybody.
say that everybody here is, please participate. It is not just, 2 or 3 people. So it would make the discussion more interesting. So here I'd like to tell a joke and a story. So when I was a postgraduate, there used to be cartoons. They used to bring the medical representatives. So there it was, a cartoon was Dr. Bad. So Dr. Bad eczema में सिर्फ steroid लिखा, और Dr. Good एक्जिमा में पहले मॉइस्चराइजर दिया फिर स्टेरॉइड दिया. ठीक है? सो दिस इज व्हाट इज नोन एज विजुअल इम्पैक्ट. सो दैट इज नॉट ओनली अ मैसेज फॉर द यंग डॉक्टर but also a message for the patient.
Very right.
Also a cartoon thing about what Dr. Good and Bad, and that is
Right.
what we tell all our postgraduates. So
Correct.
Sushmita ji is also here. Sushmita ji.
সুস্মিতা,
হ্যাঁ স্যার,
সুস্মিতা, আপনি তানুশিয়ার ব্যাপারে বলুন যে তানুশিয়ার এখন কোন ক্লাসে পড়ে? তানুশিয়া
তানুশ্রী এখন ক্লাস 7.
অভিজিৎ, you keep on translating, huh? Right?
Yeah.
Tanushia is in class 7, in 7th standard now. 7th standard now.
Yeah.
তানুশিয়ার কত বছর বয়সে ওর শুরু হয়েছিল এক্সিমা এবং কিভাবে সেটা বুঝেছিলেন আপনি?
স্যার অ্যাকচুয়ালি তানুশিয়া যখন 2 বছর বয়স, তখন তানুশিয়ার গালে হাতে রেড র্যাশ টাইপের বের হতো. সেটা লোকাল ডক্টরকে দেখানোর পরে লোকাল ডক্টর ওই স্টেরয়েড দিয়েছিলেন, সেটা দিয়ে কমে গেছিল. তারপর যখন ওটা বাড়তে শুরু করে মোটামুটি যখন 4 বছর বয়স, তখন থেকে ওটা স্টেরয়েড কেন কোনো কিছুতেই আর কমলো না. মানে স্টেরয়েড দিলেও ওই একটুখানি কমতো, আবার ডাবল রেটে বেড়ে যেত. ঠিক আছে? তো এইভাবে স্যার গোটা গায়ে হয়ে গেছিল, পুরো পাটা কভার হয়ে গেছিল, হাতটা কভার হয়ে গেছিল,
এই যে
মুখটা হয়েছিল।
স্টেরয়েড দেওয়া হচ্ছিল লোকাল ডক্টরকে দেখিয়ে, সেটা কতদিন হয়েছিল? অ্যাট এ স্টেজ কতদিন ধরে?
লোকাল ডক্টরকে প্রায় 6 মাস দেখানো হয় স্যার.
6 মাস দেখানো হয়।
হ্যাঁ, ওনাকে বারবারই জিজ্ঞাসা করেছি যে স্যার এই স্টেরয়েড এতটুকু বাচ্চাকে দেয়া হচ্ছে, স্টেরয়েডটা ঠিক আছে কিনা. উনি বলেছিলেন কোনো অসুবিধা নেই. মানে
Right.
অন্তত 2-3 রকমের স্টেরয়েড দিয়েছিলেন, ক্রিম ধরনের জিনিসপত্র. সেটা মেখে তানুশিয়ার ইনিশিয়ালি কমলেও তারপরে ওটা আবার মানে যতটুকু এরিয়ায় হতো কমে যাওয়ার পরে তার ডাবল এরিয়া জুড়ে বেড়ে যেত.
লোকাল ডক্টর কি উনি
লোকাল ডক্টর বলতে
জেনারেল
স্যার
ফিজিশিয়ান?
স্যার স্কিনের ডক্টর স্যার, বাট আমার
ডক্টরই ছিলেন, স্কিনের ডক্টরই ছিলেন।
স্কিনের ডক্টরই
আচ্ছা,
ছিলেন.
তার সুস্মিতা, 1 মিনিট। What Sushmita is mentioning about her daughter Tanushia, that at 2 years of age, she developed some itchy patches over face, over forearms and flexors. The classical description of atopic dermatitis she is giving. And she is also mentioning another very important, thing for all of us, to understand, all of us as a dermatologist. She observed herself that the doctor gave something which she could make out that this contains steroid. And she asked the doctor repeatedly. After a few weeks, the doctor you are giving this for, more than a month or so, is there any harm? But the doctor, said that there is no harm. And then she realized that with this steroid, it is subsiding, but she tried to stop it, but the moment she stops, again, it comes back. This is one message. Another thing, this is steroid abuse. And another thing is that after some time, she experienced something which we know as tachyphylaxis. The same steroid she is applying, and she is saying that that didn't start, work at all. I am applying the same steroid, but it is not working. So from her version, two important messages came up. One is that, long-term use of steroid without proper knowledge and without proper protocol is to be avoided. It has to be always in short bursts along with moisturizers. And second thing, after some time, the steroids stop working, and that is called tachyphylaxis, right? আমরা আসবো সুস্মিতা আপনার কাছে আরো। Deepika, you want to say something about this?
Oh, we have Dr. Sushovan. Sushovan, do you know Bengali? Subhojit and Sushovan?
Yes,
Sir,
ma'am.
may I?
Hi, you know Bengali?
Yes, ma'am.
So you would want to talk to, you would want to say something to Sushmita. I'm sure you understood what sir has so brilliantly translated.
Sushovan, it is interesting to know that you know Bengali. You are a Bengali.
Yes, sir, I am.
Because your name is very much Bengali. Sushovan, his name is typically Bengali name.
Right.
Right.
Sushovan, you'd like to, just say, share something with Sushmita, who's a parent of an AD
Yes.
child.
Yes, you have also heard, na, Sushovan. So you can say
Yes.
Sushovan Shaha, I can see, right?
Yes.
Right,
Yes, sir.
right. Sushovan, you have heard and you have understood that whatever she has said
He
in
can probably
Bengali.
speak, he can speak in Bengali, what we can't now.
Right. So you can talk in Bengali, no problem.
আচ্ছা, আপনাকে কোনোদিন কি ময়েশ্চারাইজার ইউজ করতে বলা হয়নি এই কালে, যে সময় আপনি স্টেরয়েড লাগাচ্ছিলেন বারবার, তখন কি আপনাকে ময়েশ্চারাইজার কখনো প্রেসক্রাইব করা হয়েছিল?
না, অ্যাকচুয়ালি আমাকে ময়েশ্চারাইজার প্রেসক্রাইব করা হয়নি। আমাকে বলেছিল যে ভ্যাসলিন হয় না, হোয়াইট কালারের যেটা ভ্যাসলিন পাওয়া যায় মার্কেটে, বলেছিলেন ভ্যাসলিন লাগাতে। ঠিক আছে, ভ্যাসলিনের সাথে একটা স্টেরয়েড ছিল এরকম, যেটা ভ্যাসলিনের সাথে মিশিয়ে, মানে ওটাকে মেল্ট করে তারপর লাগাতে হতো।
আচ্ছা,
আরো বেশ কটা জিনিস ছিল স্যার, যেগুলো মানে আমি পরবর্তীকালে যখন প্রপার ডক্টরের কাছে যাই, তখন গিয়ে জানতে পারি যে পুরো ট্রিটমেন্টটাই আমার ভুলভাল চলেছে তানুশিয়ার উপর দিয়ে, যার জন্য এতটা মানে বেড়ে গেছিল আর কি।
আচ্ছা, এই কালে আপনি কোনো কোনো পার্টিকুলার সিজনে এটা নোটিস করেছেন কি কি শীতকালে বেশি হচ্ছে বা গ্রীষ্মকালে বেশি হচ্ছে, এরকম কিছু?
আচ্ছা, শীতকালটাও বেশি সাফার করে, ওই সময়
আচ্ছা।
ড্রাইনেসটা খুব বেশি হয়। ময়েশ্চারাইজার লাগিয়ে বা ওকে কোকোনাট অয়েল মাখতে বলা হয়েছিল, কোকোনাট অয়েল মেখেও মানে ওটা কন্ট্রোল করা যায় না, তবে রিসেন্টলি ভালো আছে।
আচ্ছা, আর সাথে বারবার সর্দি হওয়ার টেন্ডেন্সি আছে কি? বারবার সর্দি হওয়া বা কনজাংটিভাইটিস এইসব বারবার হওয়া কিছু আছে, এরকম কিছু হতো?
স্যার, ওর একটা সমস্যা হচ্ছে, সেটা হচ্ছে ওর একটু অ্যাজমা প্রবলেম আছে।
হ্যাঁ, হ্যাঁ।
মানে বারবার শ্বাসকষ্টের প্রবলেমে ভোগে, মানে কিছু হয় না হয় ওর শ্বাসকষ্ট শুরু হয়ে যায়।
আচ্ছা।
Shoban, you can probably just translate because Siddharth and
Yeah,
other
right.
people.
Right.
So what I asked her was if she had been prescribed moisturizers during this period when she was being repeatedly prescribed steroids. So she had been prescribed. She had been asked to apply the white petroleum jelly, that is Vaseline, that would be heated and converted into a liquid form to apply. But at a later point of time, she did get to know that the repeated application of steroid was not going to help her as much. Though it's a good thing that at least the importance of moisturizer was the importance of moisturizing the skin was at least fed into. She got the idea, right? And second thing I asked her was if she had noticed any seasonal exacerbation, and she said that during the winters her child would suffer more. So definitely winter exacerbation because of dry skin. And in the eastern parts of India, the summers are quite humid. So it's a good thing for at least eczema patients who suffer, and winters are quite dry. So definitely winter exacerbation will be there. And apart from that, she also suffers from bronchial asthma. So another history of atopy that also gives us a clue towards the diagnosis. Thank you.
Right.
So, Dr. Abhijit, I mean, like
Yeah.
she's saying that she
Actually,
had asthma. So, do you think it's very important for the parent to also address the asthma for effective control of the eczema?
definitely, ma'am. It's a long drawn battle, and we know there is something called atopic march. That means one atopic disease may go into another form of atopic diseases. So it's very important to stress upon the fact repeatedly at every follow-up visits that why we need to follow your patient up for a prolonged period of time, not only to keep your baby skin calm, but at the same time just to prevent or early treat if any other allergy diseases develop in the due course of time. And another important point, sir, Sushmita madam brought about the steroid phobia. She herself mentioned that she asked doctors, doctor, you are using steroid for such a long time. That means there is some misconception, knowledge, or whatever you can say, myth about steroid phobia that actually does exist among the general population. As sir already mentioned, that steroid should be used judiciously with proper supervision, proper advice. Otherwise, it may cause this harm. But there is a other side of the same coin. Steroid is the first line treatment of any kind of eczema for atopic eczema. So there is no need to be afraid of or be frightened of this molecule. It's a wonder molecule. If you know how to use your sword, you will kill your enemies in front. Otherwise, you will make cut on your own body. Similarly, if you want to use steroid should be used. It's a wonderful molecule. Steroid is within our body, but definitely under supervision and proper guidance. And there is no point of being afraid about steroid. Whenever needed, we have to give steroid. And as we all know, atopic dermatitis is just like a mischievous mischievous student in a class. You can keep him calm for a certain amount of time, but at certain point of time, he or she will throw something at you. At that time, you need to scold him. You need to bring him under control. At that time, we need steroid whenever there is some kind of flare. So steroid is a double-edged sword. If you can use it, definitely you will get benefit. No point of being afraid. Don't be afraid of steroid.
So
Thank you,
the
Abhijit.
tantrum has to be managed by steroids. Okay.
Yes,
Yeah.
Tabneet,
Ignore tantrum.
Tabneet ji wanted to ask some questions or say something. Yes, Tabneet.
I think Siddharth wanted to ask, sir. Siddharth, you
Yes,
had
Sorry,
raised your hand.
sorry, Siddharth. Siddharth, yeah.
In SD case, her child suffers in winter, but in my case, I suffers in summer more than in winter. So मतलब winters मेरे लिए ज़्यादा सही रहते हैं.
He wants to know what should he do different because he has an exacerbation in summer. Which Dr. Vishal, would you like to say something?
Yes. So I would like to suggest you that you should not try to fit in your disease with what others have or what is classically found on net. Remember that everyone has a different disease, and that's why you need a rock doctor. If it was the same, there was actually no need of a doctor. Anyone could have treated you by just looking on the net. So every person, though we might be labeling them with the umbrella diagnosis of atopic dermatitis, but his atopic dermatitis or eczema is different from other person. So few people have just localized disease, few people have just one manifestation of the disease, while others may have a different manifestation. Few people may have summer exacerbation, few people may have winter exacerbation, right? And so these nuances are not there, for you. It is usually for the treating physician. You just don't try to fit in your diagnosis. Why is it not matching? Believe your doctor first is that, and second, if
Obviously.
if you feel that your disease is more during summers, obviously you need more, like as we just said, that sweating could be one of the factors. So avoiding excessive sweating, avoiding in activities which lead to excessive sweating, or performing them when the ambient environment is good enough for you. Using maybe an air conditioning becomes more important for you than other patients, right? Then
Yes.
maybe not using a lot many emollients, as we know that they themselves can precipitate lot of sweating and all. So yeah,
Yes.
obviously these things will work for you. Again, not using them in areas which are already very moist, like the groin area, like the axilla, where it's already moist during summers. So yeah, obviously these things. And I also wanted to ask both the patients. One was that how do you now deal with it versus when you initially had it? So what impact was it having in your life, and how has it changed over the years? And second, any advice from your treating physicians which you found to be ridiculous in your terms, or you found this was not actually what you needed? So yeah, these 2 points I wanted to ask from both the patients.
Yes. मतलब मॉइस्चराइजर पहले मैं यूज नहीं करता था, और अब मैं बहुत ज्यादा वैसे यूज करता हूँ, पर अभी 2 दिन से मैं यूज नहीं कर रहा। और बीपी
तो ऐसी
मॉनिटरिंग मेरे को
एडवाइस आपको जो लगी, जो आपके डॉक्टर्स ने दी, कि शायद ये बहुत जरूरी नहीं था, या जिससे आप बहुत डर गए, या ऐसा कभी नहीं हो?
ऐसा इंजेक्शंस का मेरे को ऐसा लगा था कि मतलब अगर
So I will answer for Siddharth. What he has forgotten, I remember. He got a lot of allergy testing done before he.
yes
So, and he spent a lot of money on a lot of allergy testing.
yes I have this disease since last 5 to 6 years, so
And
I
was that
suffer
ordered by
that.
a dermatologist?
No, she's been to multiple people, so he got a lot of allergy testing done.
Okay.
So, sir, Abhijit, what do you feel about allergy testing, sir?
No, I never advise.
Right.
It's a wastage of money, and if some of the if classes started coming up against some of the items, again it further complicated the patient's day-to-day activity, daily raging. So I always advise them, if at all you want to do something, just try to maintain a diary, just like a food diary. If you feel if your allergy is increasing, or you are feeling much more itchy rash over there after taking a certain food, then you can just remember and take a note. We will discuss on that. Most of the time, in 99% of time, I had never come across any that kind of allergy which is presumed, which is usually presumed by the general people. If you give a good skincare, if you come for proper follow-up, if there is a good amount of handholding, rapport building, mutual trust, we can manage it efficiently. That's what I feel. And what Dr. I just, in reference to Dr. Vishal's response, I just want to add some of the things that here actually approach should be tailor-made. Okay, as he rightly mentioned, there is no hard and fast rule that you have to follow in this fashion. According to the patient's need, according to the environment, according to his buying capacity, according to his daily routine, we have to mix and match our treatment regime. So there is no hard and fast rule. For that, you need to consult an appropriate doctor, an expert who is dealing with this disease for a number of years. He has a good amount of experience, who will explain you. Just like a trainer in the gym, you have to trust him, your trainer. Similarly, you have to trust your doctor. He will guide you what exercise you need to do or what not to do. Not to do is also very much important. You have to remember. Just like in summer months, you cannot apply moisturizer all over the body. You need to apply over the hot spot. That is the learning point from Dr. Sandipandar I have learned in last few years. This is his wisdom actually. There nowhere it was written. but with his expertise, with his experience, he learned it, and somehow he propagated that knowledge, that wisdom to us also. We have also learned. So that's how we can approach differently in different patients in different situations.
Otherwise, in India, anyway, you have prickly heat. So if you apply a lot of moisturizer,
Yes,
malaria will, or the prickly heat will cause more eczema.
right.
We have
Ale-
Dr. Dipankar sir has also joined. He is the
Oh.
convener of the academy.
Oh,
Dr.
great.
Dipankar, we can't see you.
Good evening, sir.
Good, Dipankar. Good evening, Dipankar.
Please.
I
I'm-
good
I-
evening, everyone. So
Can
I
you
want,
switch on your camera?
I am out of my house
Okay,
right now,
okay,
so-
okay, okay, okay.
and I enjoyed, or rather, I am enjoying the discussion, right? And
Right.
as far as I don't know the name, but it was written as iPhone 4. So he appears to be from
Siddharth.
northern India.
Siddharth.
Yeah, he's from
Siddharth.
Delhi. He's from Delhi. He's
Siddharth.
from, yeah,
Okay.
northern
Siddharth.
and
So-
yes, Delhi.
And Dr. Vishal and then Dr. Abhijit, I mean, they have been very to the point in their response to your query. But what you have is actually sensitivity to sweat, and sweat sensitivity is quite common in atopic dermatitis patients, right? Now, if in Delhi, there are two types of heat. Right now, it's low humidity and it's very high in temperature. And this time, you can particularly use air cooler, because it also maintains the humidity and it cools your skin. And after July or so, when the monsoon starts in, then possibly you start using air conditioner, and you have to choose the non-dry mode. So there is one dry mode in air conditioner. So if you use that, then that will cool the environment, but at the same time, it will dry your skin up, and that may actually aggravate your eczema, right? So sweat sensitivity is one thing, and how to use your cooling system at your home, that is also important. Now, if you use air cooler in the monsoon, then it will be leading to very high humidity, and that possibly will lead to more sweating. That will aggravate your eczema. So this is just one or two points that I thought maybe in addition to what has already been discussed here.
Thank you, Dipankar. Dr. Dipankar Dey is the convener of our, SACE Academy. Dr. Deepika is the chairperson and Dr. Dipankar is the convener. They two are doing a fantastic job for the society. Thank you, Dipankar, for joining and giving your insightful, thoughts, which I'm sure will be of great benefit to all our patients. Siddharth, you wanted to ask anything related to this, and I also saw Dr. Bharti in between. Dr. Bharti wanted to ask some questions or to the patients. If you are interested, please switch on. Yeah, thank you, Dr. Bharti. Yeah.
Hello, sir.
Hello.
First of all, I would like to congratulate Pashali for sharing her story of her struggle with the disease. And it is very encouraging to see patients coming up with a success story like these, because we see a lot of little kids with their parents coming up and saying that how long they have to apply the medication or be on treatment, and the struggle with the same.
Absolutely. These are actually a real life fighters, right? You see fighter movie, this is real life, but this is real life. But Paushali is a real life fighter actually. And the
Yes,
OS,
definitely. Sir, I just wanted to ask her what was the advice which gave her this courage that she continued her treatment? Because most of the time, the patients which are coming us with flare are those who
Right.
are leaving the treatment in
Right.
between because of the tachyphylaxis that is occurring due to the disease. They are shortening, they are doing doctor shopping, and a lot of other home remedies and all that, which is very prevalent in India and North India
Yes.
especially. So what advice, what actually the doctor gave her, which helped her to
Right.
continue with her struggle? That would be,
This is
because
very
one thing we struggle is how to counsel the patient about the disease for this long-term treatment. This is a very common thing that we struggle with while we are sitting in the OPD, to make the
Abs-
parent understand about disease. So
absolutely.
if you can share,
Absolutely.
I will.
You have asked a very practical point, Dr. Bharti. a very practical issue. I hope that Kaushali has got it. That from our point of view, we as dermatologists say how to hold this patient for a long time, so that they listen to us and they listen to our advices and they stick to us. They don't switch over from here and there to alternative medicines, because they will end up in trouble. So what kind of advices you got from the doctors that you stuck to the doctor? Did you consult several other doctors or one or two doctors? And how your parents were convinced initially and later you were convinced? What advices your doctor gave, dermatologist gave, which you kept in mind that this will be useful for him? How your entire thought process was changed? How you were encouraged in real life when you were struggling, your parents were struggling? Could you share with us?
Sure, sir. Firstly, I would like to mention one fact that my mom is a nurse. Okay. So when I was getting treated and I was under treatment, there were times I used to get irritated because at that age I was not able to cope up or adapt to those type of so much of medication. And yeah, I also had asthma. I was on inhaler for around 4 or 5 years as well. So that was also every night before going to sleep, you have to take that. Again, before going to school, you have to take that. Like those routines were very haphazard, making my life very haphazard at that point of time. So when I went to my doctor, obviously I was in a bad condition. My doctor had treated me well, and then my mom and my father, they tried to understand what the doctor had actually advised. So times when I wanted to get rid of the treatment and I was like, I don't want to use so much of medication because it is irritating me. I cannot do anything freely. I cannot use any cosmetic on my skin because it would affect me adversely. Right. So it was then when my mother, since she had also seen cases like that in her hospital, she used to tell me that if you have started a treatment, if you're leaving it in between, then the medicines that have been applied to your body, that might also have an adverse effect. So unless you complete a treatment, okay, fine, you're taking it for a certain amount of time. Maybe your treatment has a span of 6 months or 8 months like that, or a year or so. So if you're not completing that, it's half or it's incomplete. So either it will have zero effect or it will affect in a way that your body cannot adapt to. Right. So I did not understand so much that point of time, but then now since I'm studying biotechnology, I can actually relate to all those things. Right. So yeah, my mom had made me understand that we have to somehow complete it, or else you won't be able to apply anything you want on your skin. So since I was a child, I had this thing, okay, fine, I will be able to. That was some childish thought. But now when actually I look back to that time, so I can actually understand that, okay, fine, this was the reason.
Okay, Paushali.
Firstly, Paushali, we must appreciate your coming here and sharing, because I think that is the step one, that, when you share your story and yours is a positive story. So that actually motivates other people to keep patience and to persist with their therapy, and they will also get there where
Yeah,
you
yeah,
reach. So it is
just
very
that
creditable.
hope has to be there.
Yeah,
And
so
faith
that is
in the
very
doctor.
creditable that you are able to bring this very, positive and very enabling kind of message for other patients who are currently undergoing therapy for eczema. So we have a lot of people. We have Dr. Fareen, Dr. Safia, who are part of the team who have developed this portal with me and with the CES Society. So Dr. Safia, Dr. Fareen, would you like to say something?
Dr. Safia, could you switch on your camera, please?
Dr. Fareen is also there, sir. Yeah.
Hello, Safia. Good
You're
evening.
muted,
You
you're
are
muted, sir.
muted. Good to
Good
see you.
evening, sir.
Good evening. Good to see you. So could you just share, ask some questions or, share about
Share
this
your
platform,
experience or
your
anything.
experience, yes.
Yes, sir. So we have had a similar session previously also, and I think we have discussed a lot of such things, like the impact that the disease has on the patients, their parents. I would just like to ask one thing I have in my mind, because a lot of our patients have been talking about how their disease has affected them in a social way, like the people would not come close to them or sit close to them, things like that. But has it ever happened to any of you that your I would say word suffering has been kind of downplayed, like because it is a skin disease? Have people been telling you it's not a big deal, something like that? So to any of the patients, can please take this up. Is it like because it is a skin disease, does it happen to you that people sometimes undermine the actual effects that it has on your, on your body or on your mind?
So any one of you can take this question. I think this is a very relevant question because skin disease is, for umpteen number of times, for decades together, people used to underestimate that this is a skin disease, not a big problem. It will go on its own, or go on its own, or apply some ointment or something like that. So, partially, did it happen in your case also, or Siddharth? आपका भी उस साथ ऐसा हुआ था क्या? जब स्किन में आया तो आपको बोला गया ऐसा कुछ नहीं है, डोंट बॉदर,
हाँ, लाइक इतनी बड़ी बात नहीं है क्या, इतना क्या है ना, why to worry about, or why to go to a dermatologist, should you be really worried, something like that. ऐसा कुछ किसी ने कभी कहा?
नो साफिया, डॉक्टर साफिया, किसी ने कभी ऐसा मतलब अंडर एस्टिमेट नहीं करा मेरे को कि ये ऐसा कुछ नहीं है।
अच्छा,
सबने मतलब
आपका स्टोरी जरा बताओगे? जो शुरू में ही आपको काफी जगह पे था क्या, एक दो जगह से शुरू हुआ?
नहीं, ये स्टार्ट मेरे हैंड से हुआ था।
हाँ जी।
और फिर मतलब मैंने लोकल डॉक्टर को ही दिखाया।
हाँ जी।
और फिर उसके बाद उनने मेरे को नॉर्मल ट्यूब दिया। और फिर उसके बाद मतलब थोड़ा सही होता गया और फिर वापस मतलब होता गया। और 2-3 साल पहले इतना नहीं था, मतलब नोटिसेबल नहीं था इतना।
आपका किस एज में चालू हुआ है बीमारी?
18-19
is an adolescent onset atopic dermatitis, right? हाँ,
फिर उसके बाद मतलब इतना नोटिसेबल नहीं था। फिर जब एक्सेस होने लगा तब मैंने मतलब आयुर्वेदिक भी ट्राई किया। एलोपैथी मेरा हमेशा से ही चलता आ रहा है, तो फिर कुछ फर्क पड़ा नहीं। तो फिर मतलब ये साइकिल चालू हो गई कि विंटर्स में सही होना और समर्स में खत्म, समर्स में बहुत ज्यादा हो जाना। तो वो फिर क्या है, धीरे धीरे फिर मेरे को डॉक्टर दीपिका पंडिका सजेस्ट किया।
Safiya, you want to ask, Siddharth some more question?
ओके, अभी आप क्या कर रहे हैं? अभी आपका एज क्या है?
24 एज है मेरा।
ओके, क्या काम करते हैं आप?
बिजनेस है हमारा, ज्वेलरी का बिजनेस है।
ओके, मतलब आपका बीमारी 6 ईयर्स से चल रहा है, 6 साल हो गया अभी।
हाँ।
ओके।
और मतलब कहीं गर्मी में जाने का ऐसा कुछ काम नहीं रहता, एयर कंडीशनर में ही बैठने का काम है पूरा। मतलब घर पे भी यही रहता है और कोई एक्सटर्नल डिफिकल्टी मेरे को नहीं आती, मतलब ऐसे।
अच्छा,
मींस एनवायरनमेंट से कोई इफेक्ट नहीं होता आपके डिजीज?
एनवायरनमेंट से कुछ भी नहीं रहता मेरे को, ऑब्स्टेकल कुछ भी नहीं आता कि मतलब जिसमें मेरे को अनईजी फील हो ऐसा।
ओके,
Deepika, you can ask Dr. Fareen and others if they want to ask some
Dr.
questions.
Fareen, Dr. Lisa is also there. Dr. Lisa? If anybody wants to say or anything, Subhojit? Our Subhojit also speaks in Bengali.
Sushmita?
Sir, may I come in?
Yeah.
Yes, Subhojit. সুস্মিতা, আমি আসছি, আপনার কাছে আসছি একটু। ইয়েস শুভজিৎ, ইয়েস।
আমি আপনাকে যেটা প্রশ্ন করতে চাই, আপনি কি পার্টিকুলারলি যেটা হয় সেটা হচ্ছে নর্মাল সাবান, আপনাদের বাড়িতে যে সাবানগুলো ইউজ করেন, যে নর্মাল সাবানগুলো যেগুলো অ্যাভেলেবেল আছে, ডেটল, স্যাভলন, সেরকম কিছু ইউজ করেছিলেন, না পার্টিকুলারলি আপনাকে আলাদা করে কিছু প্রেসক্রাইব করা হয়েছিল এক্ষেত্রে?
স্যার যখন আমি প্রথম দেখাই
হুম।
এখানে লোকাল স্কিন স্পেশালিস্ট, তখন উনি আমাকে ডেটল সোপ ইউজ করতে বলেছিলেন,
আচ্ছা
ঠিক আছে।
আচ্ছা।
আর তারপর আমি যখন প্রপারলি ডক্টর দেখাচ্ছি, যে ডক্টরের হাত ধরে ও সুস্থ হলো,
হুম।
তখন উনি তো সোপ চেঞ্জ করে বেবি সোপ দিয়েছিলেন, টেডি বার দিয়েছিলেন,
আচ্ছা
তারপর সেটাফিল বার দিয়েছিলেন, ঠিক আছে।
আচ্ছা আচ্ছা, তো সেগুলো লাগানোর পরে আপনার বেটার হয়েছিল, নাকি প্রথমে আপনার লাগানোর পরে
না
প্রথম?
স্যার প্রথমে যখন ডেটল সাবান লাগানো হয়, তানুশ্রীর এত জ্বালা হয়েছিল ব্যাপারটাতে,
হুম।
প্রচন্ড গা হাত পা জ্বালা করেছিল, খুব কষ্ট পেয়েছিল ও। আমি ওটা বন্ধ করে দিয়েছিলাম, ওকে সাবান
আচ্ছা
মাখানোই বন্ধ করে দিয়েছিলাম,
আচ্ছা।
ঠিক আছে।
ও আচ্ছা, ঠিক আছে। আর আপনি আলাদা করে কোনো তেল ইউজ করেন কি? যেমন আমাদের খুব বাড়িতে কিছু হলেই যে আলাদা করে কিছু হলো, বোরোলিন লাগিয়ে নিলাম, বা সর্ষের তেল কিছু একটা লাগিয়ে দিলাম, বা নারকেলের তেল লাগিয়ে নিলাম, সেরকম কি আপনি কিছু use করেছিলেন পার্টিকুলারলি?
না স্যার, ওরকম ধরনের কিছু করা হয়নি, তার কারণ ওটা র্যাশ টাইপের হতো, তো র্যাশের মধ্যে তেল দিতে হয় কি হয় না সেটা আমার জানা ছিল না, তাই ওরকম কিছু করিনি।
ঠিক আছে, ঠিক আছে, ওকে ওকে। Actually, I asked about the type of soaps that the mother used. Basically, at the first visit, she was prescribed as normal Dettol and other which are commercially available in the market. So that actually exacerbated her symptoms. And after that, when she changed the doctor, then she was given some kind of Sindet bar, specifically Teddy bar or something, Cetaphil bar. And that actually, along with steroids and other medications, also improved her complaint. I also asked any kind of topic applications from their aspects, like whatever it's very common in India. Even I have seen in my province like Kolkata and also in Delhi that whatever appears in the skin, they just apply any kind of mustard oil or whatever oil they just get, and they just exacerbate the lesions. So they haven't applied that because they were very much concerned regarding the disease also. So that is the thing.
Right, Subhajit. Thank you, Subhajit.
That's
Thank
an
you.
important message.
Because
Dr.
right,
Neena
right,
Khanna has also joined, sir. Ma'am,
Oh,
Dr. Neena Khanna.
okay. Dr. Nina has joined.
Right. So, ma'am, if you would like to say something.
Hello, Dr. Nina. Welcome.
Hi. Actually, quite a
Thank-
bit of the conversation was in Bengali, you know.
But you
Yeah.
could follow. I mean, I started following Bengali. I understood everything. So,
that is the news to me.
right.
That is the news to me, Nina. I didn't know that.
Ma'am, would you like to share something from your experience? Ma'am has been professor and head and dean
Yes,
of All India Institute of Medical Sciences, Delhi. So, ma'am
right.
has years of experience. So, ma'am, would you like to share? We have some patients who, when what according to you is the the best advice you would give as a dermatologist?
And thanks for
Uh,
joining today,
Right.
Dr. Nina.
Yeah, I was very interested in this sort of a session. Actually, I think it's such a helpful session, you know, with the patients interacting with the doctors. So for me, apart from specific therapy, I think the pivot of therapy in eczema or atopic eczema is a moisturizer. So I think that is very important, how to use a moisturizer, the frequency of the use of moisturizer, and then avoiding the triggers, that is, I think, very important. This is a story which I always tell everybody, my patients especially. I said in a small child, it's not only what the child wears, but what the parents wear also, the caregiver wears. That is also very important.
Very
So
true.
I recall a patient who, used to wear a burqa, and she had a lot of this work done, tili work on that, and her child was not improving despite optimum therapy based on the grade of the dermatitis the child had. So I just asked the mother to stop wearing the burqa. And surprisingly, 2 weeks down the line, when the patient came, the child was completely all right. So, that I think that advice I give all my patients, that it's not only what the child is wearing, but what the parents are wearing also, which makes a lot of difference. Till the child gets out of hugging the child, hugging the mother, sitting in the mother's lap, it makes a lot of difference what the mother is wearing or what the father is wearing.
Correct. This is a very important point, Dr. Nina. Thank you for bringing it up. This is an extremely important point. We often say that the earliest sign of a small baby, just 1 or 2 months old baby or 3 months old baby, that the baby is going to develop atopic dermatitis is the rubbing of the cheek of the baby on the mother's shoulder. And if the mother is wearing a synthetic, kind of apparel or woolen apparel during winter, that the eczema comes first. This is the earliest manifestation. The baby doesn't have anything else at just 3 months of age. So you have very rightly pointed out, whenever I counsel my patients, I always tell the parents that, look, not only you avoid these amulets, charms, and synthetic materials and woolens in the babies directly on the skin, you yourself also have to avoid this, because your baby will rub their face on your chest, on your shoulder, and they will get the disease aggravated. So when you talk about this, what the mother wears, this is extremely important and practical point. Thank you very much for sharing this, input of yours, which is, I am sure, will be very useful to all, whosoever have joined over here.
Anybody else has any input? I mean, ma'am, if you have something else to say, Lisa is also there.
Come in.
Yeah.
Yes, please.
Ma'am? Yeah, actually, ma'am, I just want to issues which we were discussing for last few minutes. Number, how to keep our patients with us. This is a very pertinent question we have already discussed. But if I am allowed to, I just want to add some philosophy into it. If you allow me.
Abhijit, sorry to interrupt. Could you just switch off your camera and just talk, because your bandwidth is probably causing some problem. Your voice is getting cut. Your voice is getting interrupted.
So my camera.
You can switch off your camera. You can switch off your camera, then it will be audible better. Because you will get
Is it okay,
better.
sir?
No, not okay.
Is it okay?
No, not okay as yet.
No?
No.
Hello?
No, not okay. You just switch off your camera and talk.
Switch off. Oh, okay. I will switch off my camera and then talk. Okay.
Yeah,
This is fine?
Yeah.
Better.
Okay.
Much better.
Okay. So, first issue is that how to keep our patient with us for a prolonged period of time. So, if I'm allowed to ask Poshali, are you there? Hello. Okay. Anyway,
Yes,
what do you? Yeah. What do you feel? I mean, in any kind of relationship, what are the two most important investment? Do you think so? May I help you? I think time, and for any kind of relationship building, you getting my point? You can hear me?
Audible properly, sir.
Okay. I'm coming after some time. Okay. Hello.
Yes, sir.
Hello.
Yes, sir.
Yes, Abhijit, you are audible.
Am I audible?
You are audible. You are audible now. You can speak now.
Okay. Yeah. Poshali, what I'm asking you, for any kind of relationship building, be it in between doctor-patient, with your mother, what are two most important investment as per your thought? Obviously, it's time and honesty.
Comfort
Is it?
is the main thing, I would say.
Comfort. That means you have to spend time with that person, right?
Yeah.
So that is the main crux. Actually, maybe due to busy OPD or due to other commitments, probably on the other way around, we doctors might need to spend much more time with our patients if we are not spending till now. So that's, we can take our parents into the loop. We can explain that what is their baby suffering from, and that's how we can develop a rapport building. And regarding those childs, if we expect a child of 3 to 4 years to act according to our wish, that is not practical, right? So here we can influence them to develop some habits. Suppose if you practice the same thing repeatedly, then it becomes your habit. You might not know its relevance. That is a different issue. Just like if you trigger your neurons repeatedly, the neurons, they actually, it is actually wire together and fire together. So if you train them to apply these moisturizers at a certain frequency, at a certain interval, then after some time, even without knowing the implication, its importance, they will adopt it. So that might be one of the mechanism how we can make them adjusted to our advice or prescription. After a certain age, when they will start understanding, definitely they will follow our instructions. This is number one. And so Safia has asked a question. Have anybody asked the patient that it's a very minor kind of disease, no need to worry about this? So anybody could have discarded it or not? So my take on this point is that better we look into the other way around. I have already said, do we explain them properly every time? Probably for the same reasons, many times we couldn't. That's another reason why these diseases get neglected, and people usually they do doctor shopping from one doctor to another. So these are 2 points I want to make.
Right, Abhijit. Thank you. Deepika, if you could involve others also.
May I just like to say, I think we've heard a lot. And Dr. Neena, ma'am, do you want to say something else?
No, I actually missed the first part of it, but yeah, I just wanted to emphasize what 2 points I said: moisturizers, moisturizers, and moisturizers.
Right. And we will be meeting again. So, sir, if with your permission, we can wind up today's session.
Right.
So this
Right.
was like an icebreaker. We
So
were
now,
just starting.
yeah, I would like to invite Dr. Deepika Pandey to say the concluding remarks about today's program and future planning, because this is entirely conceptualized and executed by Dr. Deepika Pandey, chairperson of SES Academy. Deepika, if you could conclude the program with your concluding remarks and our future plan. And here we have got our SES Academy chair, convener, Dr. Deepankar De is also there on board. So Deepika, please.
Thank you, sir. And I want to thank everyone for joining, because this was something I've wanted to do for a very long time. Because I believe, like I said in the beginning, we learn from each other. And in fact, I have got a lot of feedback today about what else I should be, kind of remembering to do in my busy practice. So this is the way we learn, I mean, how we can actually best help our patients, and our patients help us understand that. So the patient support portal is with the, with the aim of answering questions sometimes which you are either hesitating to ask. No question or no query is too little. So that hesitancy should be avoided and should not be there. But we have a lot of answers to our questions, usual questions, frequently asked questions. We have video demonstrations, because seeing makes it easier to do something. So I'd like to thank all of you for joining. We'll be having more of such sessions, and the next session will be more focused. This was like a freewheeling discussion, so that it's just understanding and, it's like a rapport building. And each one had something new to add. So that is the beauty of this. Like Dr. Neena told us about the burqa, and also every time I see a burqa now, I'll remember Dr. Neena. And
Yes.
each one has given us something that will
Right.
stick. So Paushali, you have given me something that will stick in my mind. Even Siddharth, you have given me something that I will remember every time I see a patient. So this is the whole idea of this interaction and this platform. So I want to thank our president, Dr. Sandeepan Dhar from SES, for providing this platform and for enabling us to do this today. And Tapas, of course, we always remember to thank Tapas and everyone who contributed to this portal, but most importantly to our patients for joining us today. Because your joining and your putting in the time and effort for interaction is what would help us improve our management of eczema patients. So thanks a lot. And Poshali wants to say something.
Actually, I'm really sorry to ask this question at the last moment.
Yeah.
But then, since I'm staying in Chennai right now and the UV radiation index is very high here, although it's not that much humid sometimes, but the UV rays are really bad. So even after applying sunscreen, right, like sometimes I would still get this burning sensation on my skin. Like, is there any way I can prevent that?
Poshali, this ultraviolet light is more injurious for those who have got active eczema over the photo-exposed areas. So by and large, right now, you don't have eczema, fortunately, on the photo-exposed areas. But for protection of your skin, yes, you need to apply sunscreen, a good sunscreen of at least at your age, at least SPF 50. At least 6 times a day. Please do remember that. Keep it with you. Wherever you go, to your college, you just need to wash. This is what I tell my patients. Just wash your hands. You cannot, afford to wash off your face everywhere, wherever you go. You won't get a kind of situation there to wash off your hands, face. But just wash your hands with a sanitizer. Then you apply the sunscreen repeatedly on the photo exposed area. So from burning, for ultraviolet light, you will get good relief. This is one. And second thing, you please do remember that in the sunlight, there are a lot of components. Ultraviolet rays, then infrared rays. The burning occurs basically because of infrared rays, right? So not because of ultraviolet. Ultraviolet light is the silent killer, as we call it. So it causes damage, but very silently. And maximum damage occurs during winter, when people are out in the sun and enjoying the sun, right? So ultraviolet light silently causes damage to the skin. But infrared ray is a red signal which actually protects your skin. By burning, you feel you need to go to some shade. Thereby, you avoid not only infrared, but also ultraviolet light. Is that understandable? And here I would like to say one more thing. Thanks to Dr. Deepankar De for bringing that important point of sweat causing aggravation of atopic dermatitis. This has been well researched and proved now that we know that we have seen many patients of miliaria in our Institute of Child Health. The child started with miliarial dermatitis or miliarial eczema, and subsequently also the child is keeping on coming. And after a year or so, we found that child has developed classical atopic dermatitis. So subclinical miliaria is the manifestation of atopic dermatitis. This was published in Archives of Dermatology, at least 15 years ago. So sweat itself is, allergetics to the skin. Another thing is very allergic to the skin. I think all our, patients also should know, as well as our colleagues, that saliva. Many times you have seen the child has a lip dermatitis and they start licking the lips. As a result, atopic cheilitis that leads to lip lickers dermatitis. Another example of it is a small baby. I always ask the mother, please don't peck or kiss your baby too much, because that is something which this kissing or pecking sensation is converted to itching sensation. And in neurological term, there is a terminology called allokinesis. So it is converted, this touch sensation is converted to itch sensation. And as a result, the baby starts scratching after some time. These are the two things I wanted to share.
So, sir, the people who've not been given an opportunity or who were silent, Vishal Pal, we have Anish Pal, Vishal Pal.
Yes, we would like to hear from them, those who have been silent.
Vishal, would you want to say something, Pal?
Ma'am, I want to ask something actually.
Right.
During the initial phase, how much this disease affect mentally as well as academically to the patient? Like initially, when the diseases flare up, the patient doesn't feel right, doesn't she feel isolated or depressed? So how does it affect academically and at personal level? I would like to hear from Kaushali, because she just crossed all these things and now she's our successful warrior in this case. So I would like to hear this from her actually.
Since sir has mentioned academically, I remember an instance when I was in class 10, I was giving my board exam. So, and it was very hot at that point of time. It was the peak of the summer season. So, while I was writing the exam, I was feeling very itchy and I was having some irritation in my axilla and the waistline. Okay. So, I thought it might be because of the heat or something like that. So, I didn't pay much heed to it. I came back home and then I saw that there were round lesions all over my skin. I told my doctor I wanted him to diagnose what I was actually going through because it was itching so much and it was paining also and it was inflamed. So I was diagnosed at that point of time with I'm not sure if I'm correct with the term pityriasis rosea. It was something like that.
Pityriasis, yeah.
But yes.
So yeah. So that thing actually that day I was not able to write my exam nicely. So that affected me kind of academically, yeah. But then physically, of course, yeah, that is the thing.
And have you ever feel like you need a psychologist or a psychiatric doctor to be your mentally you're affected? Have you ever feel like that
Honestly
you're not able
speaking,
to cope up with the disease or
honestly speaking about that, I never felt some sort of that thing because my doctor has been very supportive both mentally and he has supported me medically a lot. And then again at home, my parents were also very supportive about the same thing as well. And me being an extrovert person, so I actually never cared, ki, okay, I have this thing. So, yeah, when I was a child, I used to be affected because I had a friend circle more. Now, since I'm kind of understanding the real life around us, so yeah, it really doesn't affect that much. So, I never thought that I need to go somewhere and get this because if I am under treatment, it is not something the psychologist can take care of that of my skin. That person can only calm me down mentally. If I am going having to take care of my skin, I have to go to my doctor, my dermat only. So yeah.
Koshali, a very good
Thank you.
message. First is your own positive, positive mindset. And second, I would put it in that order, your parents, great support, and of course, your doctors. So it starts from you. So you have been the change and that you have, kind of helped your disease go into remission. So it's mainly, your positive attitude. So that's a great story, like I said in the beginning. And
So big clap for Koshali.
Yeah.
Thank you.
Yeah, one
Anybody
thing that I
wants
would
to
like
say
to add,
something?
because
Yeah.
she said about this, she has had a very positive attitude towards her disease and everything. She has had a good support system, which is she's very fortunate that way. But I think if a patient of any chronic disease, not only eczemas, any chronic disease, feels that he needs some support, I don't think a patient should shy away from taking any help from a psychiatrist or a psychologist. I don't think there is should be any stigma related to that because it is fine. A patient who has a chronic disease tends to have mental issues, which are very much understandable. Somebody who has been having a disease for a very long time, to cope up with that, if somebody wants to seek help, I think it's absolutely fine to do that.
So that is what I'm saying. It
But if
varies
we
from person to person, like the way they are dealing with the disease.
you are a strong girl, Koshali, really commendable. But everybody is not that much strong. Well,
Absolutely.
I just want to I just want to echo what Safia said right just now. See, if our basic is very right, I mean, me, my parents, my doctor, if they are doing well in a loop, then probably we need not to see a psychologist or psychiatrist. But sometimes severity of the disease is so severe, then probably we might need to some extra help. Obviously, there is no shame about it. But we should be very particular about our basics. We doctors should spend adequate time with our parents. Parents should follow our advice properly. They should influence their childs to develop habits of just like brushing your teeth, you have to apply your moisturizers daily. That's all. That simple things actually do matter in a long run. So in this way, definitely we can win.
Thank you,
Yeah.
Dr. Abhijit sir. Would you like to then conclude?
You want me to conclude?
Yeah.
Yeah. Thank you, Deepika. And thank you, Abhijit. Thank you, everybody whoever joined today. Special thanks to Dr. Nina. Your joining made our program a very high voltage program. HOD of All India Institute of Medical Science, no other institute in the country. So she herself joined on her own. Thank you very much, Dr. Nina, for joining today and encouraging
I
us.
really enjoyed this, I really enjoyed this.
Thanks a lot. You encouraged us. We are happy to know that you enjoyed, and your joining was a big boost for all of us, isn't it, Deepika?
Yeah, true. That's what I
Yes,
said.
right. So I want to sincerely thank first Dr. Deepika for conceptualizing it and executing it, and this is the real wonder. And this is, I believe, the first time in Indian dermatology scenario this type of activity has been done, and this is an activity of global standard, as I have said at the very beginning. So anywhere in the world, this type of activity is always welcome with a lot of appreciations. So, and I sincerely thank our colleagues who joined today, like Dr. Deepankar De as convener, Dr. Abhijit Shah as my experts, then Dr. Safia Basir, and Dr. Bharti, then Dr. Sushobhan, and I am forgetting a couple of names. Deepika, who are the other doctors who
We
actually
have Dr. Vishal Pal, Dr.
Dr.
Sutoshi,
Vishal, Dr.
Anish Pal, Dr.
Yeah,
Fareen,
right,
Lisa joined, and
right,
Yasmin was also there,
right. Thank
and
you all.
Vishal, two Vishals.
Okay. Thank you
And
all.
special thanks to our patients, sir. I mean,
Yes, now
this-
I'm coming to that. This was meant for them, and they made it happen actually. So you made it happen, and the big credit goes to you all. Paushali, Tanushia's mom, Susmita, Siddharth, and others who shared their experience. It was really very thought-provoking, and it led us to led us thinking that how we can improve upon it, which Dr. Deepika earlier mentioned. We'll definitely improve upon it. Then we'll come up with more such programs in the days to come. And I also take this opportunity to sincerely thank Mr. Tapas Kayal, our Chief Coordinator of Society for Eczema Studies, as well as the our web team, Mr. Saikat and Mr. Pratap and the entire team who created this platform after a lot of hard work with Dr. Deepika and team. And there is a saying that all well that ends well. I think today it has ended well. So we really had a very good program. And at the end of the day, I'll request everybody, if possible, could you just switch on your camera for a photograph? Tapos, could you take a photograph? Tapos?
Yes, sir.
You also switch on the camera. Yeah. Can you take a photograph, which you will upload to our website?
Yes, sir.
And
Dr. Nina,
Dr. Nina,
Bharti, Dr. Vishal, एक विशाल तो है, दूसरा विशाल.
thank you, Nina.
Bharti,
Dr. Bharti,
Yes, sir.
no, your
please
video.
switch on your camera. Abhijit, this Tapos, you share this photograph. I'll share it with Abhijit. Abhijit, you prepare a write-up and
Yes, sir.
share it with Deepika ma'am and get it edited. And on Monday,
Okay.
you share it in different WhatsApp groups. Okay.
Yasmin and
Of our
Sutoshi.
doctors. Tapos, you are taking the photographs now?
Yes, sir. Yes.
Yes, Mr. Saikat, you are also visible. Thank you.
Welcome, sir.
Thank you. Thank you, everybody. Tapos, are you done with the yeah, Yasmin also could switch on, Subhojit, everybody, thank you very much. I think let us call it a day. We are finishing before time, in fact. Our scheduled time was 8:30. So
1 minute before. So thanks.
We are bang on time, sir. Bang on time.
Thank you very much. Thanks to everybody.
Good night. Bye.
Okay. Good night. Bye.
See you again.
Thank you, sir. Thank you, well.
Bye.
Good night. Good night.
See you again.
Bye,
And
Poshali. Say
Good night,
that.
everybody.
Bye.
yes.
Thank you, sir.
Thank you, everybody. Thank you, Poshali.
Everyone.
And thank you, everybody. Have a happy weekend.
Thank you, sir. Thank you, sir.